You're listening to Vet Synapse, a podcast connecting the world of research, innovation, and practical help to the veterinary profession. I'm your host, Dr. Philip Judge from Vet Education. Let's get connected with Vet Synapse. Hi everyone, it's Philip here from Vet Education. Today I want to talk about the use of serum amyloid A and C-reactive protein as biomarkers for systemic disease in the cat. We know that CRP has been used and written about quite extensively in dogs, but less so in cats. And I want to just talk about the value of CRP and introduce the concept of using serum amyloid A as perhaps a more useful biomarker for systemic disease in the cat. So let's get underway. By way of introduction, systemic inflammation in the cat can arise from a pretty diverse range of conditions, including bacterial and viral infections, immune-mediated diseases, neoplastic diseases, trauma, as well as chronic inflammatory states like obesity, for example. Clinically, being able to detect the presence and severity of systemic inflammation early in disease can be quite helpful in directing diagnostic and therapeutic efforts, as well as, objectively monitoring the response to treatment. Acute phase proteins synthesized mainly by the liver in response to pro-inflammatory cytokine release can serve as valuable biomarkers for such purposes, the monitoring. Among these, as I've already alluded to, C-reactive protein and serum amyloid A have emerged as the most clinically relevant in canine and feline medicine. However, unlike in dogs and humans, where both are considered major acute phase reactants, the cat exhibits a pretty distinct acute phase response that's characterized by significant differences in the magnitude and behavior of these two proteins. So understanding the differences between C-reactive protein and serum amyloid A is essential for the rational clinical application of these biomarkers in the diagnosis and management of systemic disease in the cat. So what is C-reactive protein? C-reactive protein is a classic acute phase protein that in many species undergoes a dramatic increase in concentration during inflammatory states. Now in the cat, however, it's classified as what's called a moderate acute phase reactant, and so is therefore characterized by a more modest magnitude of increase in systemic inflammatory states compared to both the dog and the human. And this species difference has historically limited the perceived utility of C-reactive protein in feline practice. But as we'll see as we go on, it can be utilized as a clinically useful biomarker when interpreted appropriately. There was a study that investigated bacterial infections in cats, including cats with bronchopneumonia, gastrointestinal infections, and urinary tract infections. And these cats demonstrated CRP concentrations that were markedly increased compared to healthy control animals, indicating that there is a potential utility of this as a marker of inflammatory diseases, at least associated with infectious diseases in cats. Importantly, this study revealed that CRP response was more pronounced in bacterial infections compared to viral infections, and that also might help us utilize CRP down the track. CRP can also become elevated in non-infectious inflammatory states. So obesity in cats is now recognized as a state of chronic low-grade systemic inflammation that's kind of analogous to the metabolic syndrome described in humans. There was a study that evaluated serum C-reactive protein or CRP concentrations in obese versus non-obese cats, and they found a significantly higher CRP level in the obese animal group. And this has got implications for identifying cats at risk for obesity-related comorbidities as well. Let's talk now about serum amyloid A, because it has been recognized as a major acute phase protein in the cat. Remember, CRP is a moderate acute phase protein in the cat. So serum amyloid A is a major acute phase protein in the cat and is recognized as the most sensitive and rapidly responding acute phase protein in cats. In response to inflammatory stimuli such as tissue injury, infection, immune system activation, Serum amyloid A concentrations increase rapidly, oftentimes by several hundredfold, making it a really sensitive marker for the presence of systemic inflammation in the cat. Furthermore, non-inflammatory diseases such as cardiac disease and endocrinopathies, including hyperthyroidism and uncomplicated diabetes mellitus, are not associated with increases in serum amyloid A, and this can be really helpful in differentiating inflammatory from non-inflammatory diseases. In addition to being an inflammatory biomarker, chronic or recurrent elevation of serum amyloid A can lead to the development of systemic amyloid A amyloidosis, which is a protein misfolding disease in which the serum amyloid A breakdown products are deposited in tissues, most commonly in the kidney, medulla, and interstitium, causing renal amyloidosis. And this condition is pretty well recognized in cats, especially in certain breeds, and also in association with chronic inflammatory diseases like chronic enteropathy, chronic skin disease, and chronic infectious processes. There was a recent study characterizing renal amyloid A amyloidosis in cats that demonstrated that persistently elevated serum amyloid A concentration correlated with progressive dysfunction of the kidneys, proteinuria, and increased urinary excretion of serum amyloid A. So, with that in mind, what are the key differences in serum amyloid A and C-reactive protein in the cat that has systemic illness? Well, the fundamental distinction between serum amyloid A and CRP in the cat lies in their classification as major versus moderate acute phase proteins, respectively. And this difference manifests clinically in a few important ways. Firstly, the magnitude of the response differs substantially. So, in a cat with significant systemic inflammation, serum amyloid A concentrations will typically rise to a much greater degree than CRP, making serum amyloid A a much more sensitive marker for detecting the presence of inflammation. Secondly, the pattern of response can also differ according to the underlying disease. A study we mentioned before that looked at inflammatory profiles of cats with bacterial versus viral infections found that cats with bacterial infections exhibited a marked increase in both CRP and the pro-inflammatory cytokine interleukin 6, whereas cats with viral infections did not show a significant CRP elevation despite having clinical signs consistent with systemic illness. So we've kind of gone through the diagnostic utility a little bit in our discussion thus far, but the diagnostic utility of both serum amyloid A and CRP in the cat encompasses detection of systemic inflammation, differentiation of underlying causes like bacterial and viral, for example, and also prognostic assessment and monitoring the treatment response. So what I want to do now is just walk through how we use these biomarkers in systemic inflammation in the cat. So as the major acute phase protein in cats, serum amyloid A is the most sensitive biomarker for identifying the presence of systemic inflammation. It causes a rapid and dramatic rise that makes it the preferred screening tool, but especially in cases where clinical signs are subtle and non-specific. For example, in a cat presenting with lethargy and inappetence or fever of undetermined origin, a markedly elevated serum amyloid A confirms the presence of systemic inflammation and supports the need for further diagnostic evaluation and treatment as well. Conversely, a normal serum amyloid A concentration makes significant systemic inflammation much less likely, and that can enable you and I as clinicians to redirect our diagnostic efforts. The second major point there is that these biomarkers can help differentiate the underlying cause. The differential response, for example, of CRP to bacterial versus viral infections provides an adjunct to infectious disease evaluation. In a cat with clinical signs compatible with, say, upper respiratory tract infection, for instance, a normal or mildly elevated CRP might support a viral etiology, whereas a markedly elevated CRP might raise suspicion for bacterial involvement. And that can have influence on the use of antimicrobials, for example. Similarly, if you've got CRP elevation in obese cats, that might prompt an earlier intervention with weight management strategies before overt metabolic complications develop. Thirdly, I want to talk about prognostic assessment because while serum amyloid A and CRP are not independent prognostic indicators in the same sense as, say, scoring systems like the Apple or Animal Triage score, the SOFA or QSOFA scores, their magnitude and persistence of elevation do provide some prognostic information. For example, in septic patients, failure of acute phase protein concentrations to decline following appropriate therapy should prompt reassessment of the treatment strategy in that patient, or perhaps increase investigative efforts for complications such as unresolved infection or nosocomial infections, for example. Next, I want to talk about monitoring response to treatment because these biomarkers have got quite short half-lives, both serum amyloid A and C-reactive protein, and that makes them quite useful for monitoring treatment response. So in a cat with bacterial pneumonia, for example, serum amyloid A and CRP concentrations should decline rapidly following institution of appropriate antimicrobial therapy and supportive care as well. A lack of decline in the concentrations of these biomarkers might indicate treatment failure or perhaps the development of other complications like systemic inflammation, SIRS, and sepsis, for example. And finally, I just want to talk about some practical considerations because both serum amyloid A and CRP can be measured using commercially available assays, including point-of-care laboratory-based platforms as well. The reference intervals vary between these assays, so we need to be familiar with the performance characteristics of whatever assay we're using in our practice. In general, serial monitoring is more informative than a single measurement, as trends over time provide the most clinically useful information regarding disease progression and response to treatment. So to wrap up, both serum amyloid A and C-reactive protein are valuable biomarkers for systemic disease in the cat, but their clinical utility is defined by their distinct biological roles and response characteristics. With serum amyloid A, it's the major acute phase protein in the cat and is highly sensitive and rapidly responding marker for the presence and severity of systemic inflammation. CRP, on the other hand, is a moderate acute phase protein in the cat with a more modest magnitude of response, but it still can be useful, especially for characterizing inflammation, distinguishing between bacterial and viral infections, and for detecting low-grade chronic inflammation, as seen in cases like obesity. So in practice, serum amyloid A serves as the most sensitive screening tool for detecting systemic inflammation, while CRP provides an additional information that might help you characterize the underlying disease and can help in some instances guide treatment decisions. In all of the considerations we have had and made, serial monitoring of either or both proteins can help provide objective, quantitative data to assess the treatment efficacy and in some cases might be able to predict outcomes. I hope you found this discussion useful. If you've got any questions at all, please feel free to type them in the chat below the podcast. Thanks very much, everyone. If you'd like to hear more of this podcast, why not become a Vet Education member, where you'll not only get access to podcasts, but our entire webinar library, plus a huge journal library, special offers, discounts, and a whole lot more. Check out the website veteducation.com for more details.